try to work with my clients with is people are very unlikely to know you're having a panic attack unless your behavior indicates that. So think about the symptoms we talked about. Racing heart. No one can see your heart race. Rapid breathing. Well, typically with the rapid breathing in panic disorder, people tend not to see it. It's more the behavioral response, people gasping for air. They're trying to get air. They already have too much air in. But typically the hyperventilation that's going on is sort of at a subtle rate that most people will not see. It's their behavioral response. Tingling in your hands and feet. Nobody can see that. Chest pain or pressure. They can't see that. Tightness in the throat. They can't see that. Dizziness or lightheadedness. They can't see that. They're feeling you're going to faint. They can't see that. Now, people, well, what if they do see me faint? And we're going to talk about this. You're very unlikely to faint when you're having a panic attack. Not going to happen. If you're a panic disorder, we're not going to expect people to faint, despite what you might have seen on some TV shows or movies about people passing out when they're having panic attacks. I tell my clients that's not what is typically going to happen. So what I like to do is, in part in understanding my client, but also in helping them understand what happens, I like to draw out a model of their panic cycle. So which could be modeling, writing out what the triggers are, their internal sensations, what their thoughts and their behaviors are. And I'll go through a series of questions. Well, what happens first? When that happens, what happens after that? Okay, now that's happened. What happens after that? And you may kind of go through this model a few times and tweak it a bunch. But to give you sort of an example here, and I'll draw this on a whiteboard. You can draw it out on a piece of paper for them. You can draw it on a whiteboard. They can take a picture of it, or draw it on a piece of paper. They can take it with them. So for some person, they might say, well, you know, my fear is triggered whenever I'm driving on the highway or in crowds. Now, we talked about on Q for looking at basic safety. At the same time, we want to be able to push things so that we can challenge ourselves to be able to engage in things that we're avoiding right now. So I think if there are things, so like I mentioned earlier, that I have, sometimes I work with students who they can only get to school if they're using some of these safety behaviors. Like I've got to sit right next to the door of the classroom. Okay, initially, let's do that. That's what's going to get people along. Then we're going to start to push ourselves a little bit further past that. So we want to build that exposure hierarchy. And we're going to think about two types of exposure hierarchies. One, we call the in vivo exposure hierarchy, which is real life exposures. What are some real things that we can do in the real world? And what are some imaginal exposures? Imagining a feared consequence, what anxiety bring on, and how close this to what they feel during a panic attack. So some questions I'll do. I will ask them, what are the sensations you're experiencing? How intense are those sensations? So write down what the sensations are. 0 to 10, how intense they are. How much anxiety are they feeling right now? And how similar is this to what you experienced during a panic attack? So there's a couple of different models that we would look at. There's the habituation or the fear processing model of anxiety, and there's the inhibitory learning model. So first we're going to talk about the habituation model. So what we look at there is that we would see as we do these exercises, we have someone do something like hyperventilating, and we're going to expect that anxiety to go up and come down in session. We're going to do it multiple times in session because they're feeling better. And then between session as well. So